the Institute for Health Professionals Development is the ideal Sierra Leonean public health practitioners and scholars living in the country and the diaspora. The founders aim to support government and development partners' effort in strengthening the national health system through health workforce development and maximizing public health impact through high-quality, relevant professional training programs linked directly to service delivery. Well, for more on that, we have in the studio Professor Mohamed Kanu from the Institute for Health Professionals Development. Good morning, welcome to the program.
Thank you, madam. Thank you very much for having me here.
Okay. So start by giving us what was the actual driving force for the establishment of this institute. Is it that there is a gap in that area?
We think so. We think so. You can never have enough of health professionals in the country. The idea actually started, I would go back, or go as far back as 2017. I came into the country as a public health professional consultant at the end of the Ebola. And then I met this gentleman, Dr. Alhassan Kanu. By the way, there is no biological relationship. But we talked about many things. And after I left, he thought, you know, what a great idea it will be for us to start a center. So this is actually his brainchild. And so he contacted me, and in consultation with many other people, we decided to start what is known as CFI for short. It's actually the Center for Public Health Improvement. And it's located along the highway, I think it's Dibiawata, you know, well, as people call it locally. So there's a twin tower building there to your left as you approach Waterloo. So the center has been, as I said, in existence since 2020. This year, or late last year, we decided to add yet another piece to this, which is this Institute for Healthcare Professionals Development. The goal is to help our people acquire training while they are in service. And we are doing that in consultation with several other partners that I may have some time to talk about. But again, the goal is to make sure that we do not stop at just acquiring theoretical knowledge. We want to make sure that we help teach our people, those who need the training, at varying levels. You know, again, we are not saying, oh, somebody has to be seeking a PhD or a master's degree. We take the whole gamut. So if it's a diploma, it's a certificate that you need to have. That's our aim. We want to make sure that we provide the training that is needed to complement the work of the Ministry of Health.
So do you target all health workers in Sierra Leone?
I would say yes, and the way I will explain that is this. So rather than having a curriculum that is set in stone, we maintain flexibility. So if an institution or even individuals have a need to strengthen capacity in a particular area, come to us and we'll talk about that. Let us understand what the outcomes you are seeking are. And then we sort of develop a curriculum that will address your needs. So that's what we are doing. So in other words, we will work with private institutions, we will work with government entities, and just make sure that we continue to improve health outcomes in this country. It's very sad you're talking about this gentleman, who I believe is a young man by all practical purposes. Just based on the little that I know about health, I don't think whatever he died of came, you know, as a total surprise. But who knows? I mean, I don't know the full story, but we want to make sure that we contribute to the development of health outcomes by helping train health professionals where the training is needed.
Okay, so let us know these areas that you'll be training them. What particular?
Well, again, you will imagine if you're talking about the health sector of a country, it can be anything from community health development to hospital management to disaster response, preparedness and response, community health nutrition, issues of environmental health. So again, we remain flexible. And let me add this. We don't have all the training experts that we need in-house here in the country. I want that to be known. In my current job, I serve as the Associate Dean of the College of Health Sciences at Tennessee State University in the United States. We have 8 departments, from dental hygiene to nursing to physical therapy to occupational therapy, public health, and what have you. If there is a need, for example, within any of the entities in our country, private or public, and we come to terms in terms of what they need, we can bring some of those experts to make sure that we provide the training that they need. So again, it depends on what the need is or where the need is.
Okay, so one would be tempted to ask, how is this institute different from other public and private institutions that give out these trainings to health workers in the country?
In a number of ways. I'll mention two here because of time. The first one is something that I already alluded to. So we don't develop the curriculum before we find out what people need, what institutions need. We want to talk to the institutions first, and then they tell us these are the areas in which we want our people, staff, however many, want them to be trained. And then we develop it. So we maintain flexibility from the outset. We also emphasize practical knowledge. Sometimes we go through training, through whatever institution, and we have the theoretical knowledge. But sometimes application is very difficult. So in addition to theoretical knowledge acquisition, we also really emphasize practical training.
Okay.
So those are two areas. And then you may talk about sustainability. One thing we are considering very seriously is helping people write programs to seek funding so that they can support their programming.
Okay. On digital thoughts on the program is Professor Mohammed Kanu from the Institute of Health Professionals Development, IHPD. Well, from there we'll move on to another. We'll quickly bring in Professor Mohammed Kanu. So before we leave you, in the area of sustainability, how would you ensure that this continues? Because you know the challenges that the healthcare workforce faces. How would you ensure that this institute continue to give out the necessary courses so that they can be equipped?
Thank you very much. Brilliant question. This is very true in especially the African landscape. What we have done is to put together a team of people who can write grants. Myself, Dr. Al-Hassan Kanu, who is the CEO, and Mr. Philip Amara, we have Mr. Clifford Kamara, and several other people. That is going to be the mainstay activity, if you will. So we will write grants. We will go and look for money where money is. Our recent story, success story, is a grant that we received, provided by the Bill Gates Foundation through another university in Access. Not a whole lot of money, but it's $100,000. So we were able to use that to just completed a study on family planning promotion in the country. It was last week when we shared those results in the presence of the Ministry of Health that have also been starting from the CMO to Dr. Smart, Dr. Tom Sise, and several other people have given us a great amount of support. The other, so grant writing obviously is one, but we also we will have to engage development partners. A lot of times development partners have resources to fund activities. If you come to them with a clearly defined plan, show them how you're going to implement that and be willing to answer to accountability, they will provide the type of funding, even if it's not the amount that you need, but they will always provide some seed money. So we want to capitalize for a start on those two strategies to make sure that we sustain our young organization.
Okay. Many thanks to you, Professor Mohammed Kanu from the Institute for Health Professionals Development, and also